All right, let's broach the controversial topic of vaccines and perhaps their link or not link to autism. Now, as some of you guys may notice, Robert F. Kennedy was named head of HHS, so he oversees a lot of these agencies, include the CDC. And Dr. Dave Weldon has been nominated to take over the role of head of the CDC. Now, Dr. Weldon is a former congressman from Florida, and he has actually expressed concerns over the possible links of vaccines and autism, pointing to the adjuvant thimerosal, one of the mercury-containing compounds, is perhaps being contributory to this. So he is already seen as a quote-unquote vaccine skeptic and will be heading the CDC. So now they're planning on doing a study, and I asked people, if they do a study or series of studies, will you be confident to believe the results of the studies? And most people said yes, some people said no, and some people said it depends if it matches my already held beliefs. And I will say that, with full transparency, I'm not an immunologist, I'm not a vaccinologist, I am not an expert in vaccines. I do have an autistic child who was vaccinated. But if you ask me, do vaccines cause autism? And what I will tell you is, I don't know. I just simply don't. I think likely this is a problem that is, multifactorial. Some people say we're just better at screening for that. And undoubtedly some of that's true. Maybe some of that increase, in incidence can be attributed to some of that. There are likely a number of factors that contribute to it. Could it be vaccines? Perhaps. I'm certainly, given the track records of these pharmaceutical companies, to include, companies like Pfizer, which makes vaccines, they have been convicted of fraud multiple times. So, their history is a little bit skeptical. We see these companies all paid billions of dollars fine for literally lying to us. And so you have that, right? There are also studies that show, like, for instance, diabetes. If a mom is diabetic, the odds of her child having autism go up 4 or 5-fold, 400 or 500% increase in likelihood. So likely it's a combination of things. And it could be the fact that, some of the people that say, well, we've already tested the vaccines and they don't cause autism. The criticisms will say, we didn't do a true placebo, comparison test. Whereas to say, instead of giving vaccine plus all the, extra ingredients versus saline, we just did, take out the live vaccine and just keep the extra ingredients in both of them. And maybe it is the extra ingredients. Maybe it's the aluminum, maybe it's the mercury, maybe it's something else that's related to this. Maybe it's the cumulative effect of lots of them. Maybe it's one, but not another one. So it's a hard question to answer. I am fairly confident that given, RFK's leadership at HHS, assuming Dr. Weldon gets in as head of the CDC, they will design a transparent team that will hopefully be free of conflict of interest and will do, the studies that probably need to be done. And hopefully they can put some people's minds at ease, or at least show that the true risks are. Now, what I am not a fan of is mandating. I said the same stuff around the COVID stuff. I thought it's ridiculous to mandate these things on anybody. So people should be fully informed. So we need really good, transparent, informed consent with real, true, clear data. And we need to be given choice. All right, those are my thoughts. What are yours? Talk to you soon.